Once upon a time, Daniel heard alarms inside Bioreactor 3. It was day 9 of monoclonal campaign nearing completion deadline. Temperature screens flashed 38.2 degrees Celsius steadily. For 47 minutes, no response came from control panel. Operators hesitated, assuming minor sensor instability only during routine production. Daniel felt something heavier than routine fluctuation in his gut. Temperature was a critical control parameter here for cell viability. Exceeding limits threatened product quality and patient safety downstream assurance. He immediately froze the batch within SAP, preventing further processing. Physical tags mark the vessel as quarantined inside manufacturing suite. Engineers stabilized cooling while alarms continued echoing across stainless corridors. Management demanded answers before deviation deadline expired that same day. Daniel opened TrackWise, initiating formal incident record before 24 hours. Every logbook entry suddenly seemed dangerously important for regulatory auditors. He reviewed trend charts, searching hidden anomalies within temperature data. He interviewed operators about workstation configuration changes during shift turnover. One temporary monitor blocked critical alarm banner from primary display. The alert had flashed unseen for minutes during configuration adjustment. It was not negligence, but visual management failure within process. A small obstruction nearly risked entire campaign worth millions invested. Corrective actions redesigned layout and alarm visibility standards immediately implemented. Preventive training reinforced reporting urgency beyond assumptions across all teams. After days reviewing data, impact remained contained with documented justification. The batch survived because procedures overruled panic and protected patients. Daniel finally exhaled, understanding the deeper lesson about disciplined escalation. In GMP, small missed signals demand immediate structured response always.